and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together we
therapist.
are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
3 best self-tests for supraspinatus tear or injury. This is a common shoulder pain, probably one of the most common ones there is.
Right. I would agree, Bob. And not only that, of the supraspinatus problems, most of those are probably impingement problems, which we hear about a lot.
Sure. Before we go into the weeds here, let's talk about, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on our social media platforms because we're always giving away something, and we're always trying to be funny. And we don't succeed at the second one, but we always succeed at giving away something.
Yeah,
but
but we
pretty nice stuff.
Right. We look funny though.
Yeah.
Yeah.
We got that going for us. All right. So again, yeah, probably not only is this the most common shoulder pain, it's probably the most commonly injured tendon. Wouldn't you say?
Oh, right.
Of the possible tendons up in the shoulder.
Right. I would say 80–90% of the people I rehab after rotator cuff surgery, it's this tendon.
Sure.
Mm-hmm. So, which tendon are we talking about? Let's be a little more specific if you're not familiar with the anatomy. First of all, we're looking at the right shoulder here, and we've got a nice little model here of the shoulder. And this is actually the scapula.
Or the shoulder blade.
Or the shoulder blade.
Yeah.
Right back here.
Yep. Back here, yeah.
So there we are.
This is
Bob's. I'm going to pop it right off of them there. You don't have it there. And now if we were to take the muscles off, the big deltoid muscles, we remove those and, of course, the skin. And now we're looking at just the muscles of the rotator cuff. Yep. We got 2 here. We got the supraspinatus here. Should I get a little closer, Liz? There we go. And then, of course, we've got the one on the inside. You got all those memorized, Bob?
Yeah, sure. Sits.
What?
Sits.
Sits.
Yeah.
S-I-T-S.
Subscapularis, infraspinatus, supraspinatus, and teres minor.
There you go.
Yeah.
Unbelievable.
Yeah.
You remember that from school.
Yeah.
I was just testing them. So anyways, we're looking at the supraspinatus because here's the spine of the scapula. Supra means above, so we got the supraspinatus.
Yeah.
And the tendon, if you look here, you can see the tendon is actually a broad tendon. It's not like that tendon you commonly see in your bicep. And actually, I always thought this was kind of like that, but after investigation, it's very clear. It's a broad tendon, and it's part of the rotator cuff. Just as
I agree with you 100%, Brad. I thought it was a thin, narrow tendon too, but it's a big, broad one. And that's why you can kind of get pinholes in it, and you can get partial tears.
Right.
And there's still a lot of tendon holding things in place.
There you go. So the first thing we're going to do to test is simply actually what we call palpate, or feel right over that tendon and see if it's inflamed or tender. So there's a nice little test that if you take your hand and the backside of your hand and put it right where your pocket opens up, right there, that's over your greater trochanter, like this. That internally rotates the humerus, and then you're going to go to the top. You're going to find that bone, the acromion. It's the only bone that really has no muscle on it. Then you're going to go forward and drop down about 1 inch, and you're going to just push into there and rub back and forth and see if there's a tender area. Now, sometimes it's tender and it's healthy because you're pushing too hard or you're pinching it, or it depends on how sensitive you are. But if you compare it to the opposite shoulder, that's the nice with all these tests. Do it on one shoulder and then do it on the other and see if you notice a significant difference. And that's one of the tests is right there. Okay, if it's like, whoa, it's just tender, you'll know, because it kind of makes your eyes open up, and you don't want to do it.
Not very subtle. It's
right.
You can tell right away.
There you go. So again, compare right to the left. That's test number 1. Number 2, we call it scaption, flexion. Okay, so in therapy words, we say flexion is straight up in front, and abduction is out the side. Well, scaption is kind of not halfway in between, but it's a pretty close to that, where this is straight out to the side, straight in front. We're going to go
right, kind of in between.
Right, you just figure about halfway, and then you're just going to go up like this. Now that is the muscle that's responsible for that largely is the supraspinatus. Now we can get more particular and go palm down. This is called the empty can test, and do that, and that really gets at that supraspinatus.
Now, Brad, would you want them doing both at the same time to compare, or would you just do one at a time?
Well, I would just do one at a time,
Sure.
but you could try both, and it's going to be pretty clear on this one. If one feels fine and the other one hurts, and particularly more, out in this range. And then with the palm down, the empty can test even be
And
more
as
specific.
it were, Brad, I just recently went through this,
Sure.
supraspinatus tendonitis, and mine is still a little bit sore.
And you notice it.
Yeah, and I noticed on this side, this is the only test of the ones we're doing today that I notice it on.
It's
This
still
one
positive.
I don't notice it on. I don't palpate it. I don't figure it.
Okay.
But
So
I still
it's
feel-
still hanging in there.
just hanging in there, but
Yep.
it's much, much better. I
Yeah.
don't notice it throughout the day at all.
Sure.
So
Now, this one I see a lot with patients. It's called, I call it the painful arc syndrome.
oh, sure. Yeah.
But we're going to go an abduction, so straight out to the side. Your palm is going to be down as you go through. It's not thumb up or palm up, it's palm down. And then you just go out to the side. Now, if you feel some pain in this range, that's the painful arc syndrome. But then once you get above 90 degrees in this area, it's like, oh, feels okay up in here. And then when you lower, it's like, oh, it hurts again coming down through that range. That's another positive sign that you may have supraspinatus impingement or inflammation. So
yeah,
again,
I feel just a little bit now.
Little
that
bit there.
Yeah, a little bit.
Yeah.
Compared to this side.
and then when you get up higher, it's okay.
gone. Yeah.
Right. Now,
So-
we're not going to get into the mechanics of it, but as a therapist, it really makes sense why that happens. So go through all three of these tests, compare one side to the other, and then see if one of them is positive, or like Bob, he has two that are semi-positive.
Semi-positive.
Yeah, so maybe he's got some supraspinatus injury or impingement, but it's not clear. If it's like real tender, the empty can one hurts, and this one you can't get through that 80-degree range. It's not 100% certain this is a problem, but it's a pretty good chance then.
So if you find that, just go to, type in Bob and Brad
Right.
and YouTube and put impingement.
Right.
And we have lots of videos on how to treat this.
Right.
So,
Or we have some under supraspinatus as well.
supraspinatus as
Yeah,
well.
we
yeah.
do got a few videos out, Bob.
Yeah, we do. 1,700, I think.
We're
so.
trying to help in every which way we can. So once again, Bob, we can cure just about anything except,
A broken heart.
there you go, Bob. But once again, we'll continue to
We'll persevere.
persevere. Exactly right, Bob.
All right.
That's what they said about Edison. He did a lot of persevering
He
on that
did.
light bulb, and he
That's
got
right.
it.
He failed 1,000 times. But
I think it was 10,000.
10,000
I
times.
think so.
Okay.